I'm going to share a demo of an app that I've wanted to build for a while, and I finally got the chance to. It's a clinical scenario chatbot, a scenario where you play the role of a doctor and a patient comes in to see you, you have a conversation and try to make a diagnosis for the patient. What we have here is we have an AI patient. Their name is Donna, she's a 65-year-old woman, and we have 15 minutes to interview Donna. And so I've simulated 15 minutes by saying we've got 10 messages that we can ask Donna. And on the back end, what's happening is we've told the AI everything that we think could be relevant around Donna's history. And so what that means is that now, as a user, I can ask the patient questions. So I can ask something like, I can ask what the symptoms are. So since the first couple of weeks, even with rest, with minimal activity, they've been getting worse. Okay, so I've finished my conversation, I've ended the chat, and at this phase I get some feedback. So stepping out of the role of doctor, now I'm receiving some feedback. This is feedback that's guided by the instructor. And what I told the AI in this case is to provide feedback on whether the doctor, whether the user has provided appropriate questions, how their bedside manner is, and whether they've stayed on topic. It looks like overall the AI is fairly happy with me as the user, empathetic, supportive, staying on topic. No surprises there. And then we have a chance to diagnose. We get out of kind of the chatbot experience and go into more of an instructional exercise. The first question is, what is the user's primary complaint? That's simply trouble breathing. And then we want to establish a differential diagnosis, which is when you give the options for what you think the diagnoses might be and further tests that you want to run. And so I happen to know, because again, I put this case in the back end, that COPD and lung cancer are potentials, and asthma is probably not, even though it's a breathing issue, it's actually probably not something that Donna is experiencing. So let's submit that and get the feedback. And what it tells me, again, based on, I'm asking the AI in the background to do two things. I'm asking it to assess my diagnosis and the evidence I've provided, and also determine if I could have gotten that evidence from the conversation that I had, because it knows the history of that conversation. So COPD, strong consideration, lung cancer, and then asthma. Asthma usually presents earlier in life, so it's telling me that unlike COPD, asthma is less likely given the conversation that you had with Donna. Nonetheless, we do have a score at the end, so I gave, even though asthma was not exactly right, I gave enough of a primary complaint and a differential diagnosis to continue and pass. So this was, again, something I've wanted to build for a while. I think with some tweaking around what specifically feedback you'd want to give to a student who's going through this scenario, I think that AI plays a pretty good role in being able to practice these kinds of simulations, whether they're medical simulations or otherwise. And I haven't included the build video here. If you want to see the build video, you can go to the website, appsforeducation.ai, and check it out there, just so that the video is not so long. I'm trying to keep these down to a couple minutes.